Hi, my name's Pauline and I'm from Salute, which stands for Save a Life, Understand Trauma Experiences. And in this short presentation, I'm going to be explaining how our treatment is different, types of trauma, and what trauma is. So what makes us different? We are brain spotting psychotherapists or trauma therapists, and we're dedicated on changing how society responds to trauma and interpersonal trauma, as this is being overlooked as the root cause for most mental health issues. We use the 21st century methods to release trauma issues. We offer healing rather than coping. We help people gain their lives back. This is an holistic treatment. It treats the whole person, the mind, the body, the emotions, and the brain. So what is real trauma? It's when one's capability to cope is overwhelmed, an emotional shock followed by a stressful event or a physical injury, a deeply distressing or disturbing experience, and any negative life event that occurs in a position of relatively helplessness. Types of trauma: PTSD, bullying, early childhood trauma, community violence, complex trauma, domestic violence, medical trauma, physical abuse, sexual abuse, traumatic grief, secondary trauma, media trauma, disasters, refugee trauma, terrorism and violence. And we put these into subcategories like macro trauma, dissociation trauma, development trauma, event trauma, acute trauma, chronic trauma, macro trauma. Coping. The individual may attempt to suppress these memories to be able to cope and lead a normal life. The traumatized individual, not having the means to properly deal with the trauma, stores it within and struggles with it on a daily basis. The longer these memories are held onto in the brain, the more they create distortion in the individual's mental process, leading to a mental health disorder. What is brain-spotting psychotherapy? Brain-spotting is a new model of psychotherapy. It is a brain and body-based therapy using biological sound. It's created to help people overcome negative and traumatic emotions, physical trauma as well as psychological induced physical pain. How does BSP work? This holistic treatment works by identifying, processing and releasing stored negative or traumatic experience from the brain to help the affected individual heal from within. It also promotes healing for individuals suffering from physical pain. BSP therapy suggests that the brain can heal itself from the inside. Its aim to stimulate the brain's healing ability by evoking and releasing the negative emotions and experience that have been stored in it. It does this by identifying an eye position that triggers and releases these emotions. This is based on the concept that an individual gaze can affect how they feel. It leads to the theory that the eyes have an intense relationship with the brain. Furthermore, BSP is based on the fact that trauma is stored in the body and can be activated and triggered at certain eye positions. We talk about the survival part of the brain, the fight or flight, but what about the freeze, when in a split second, colour, sound, smell, vision and feelings are frozen in the memory and the body? This therapy helps the individual access, process and release these stored emotions to begin their journey to recovery. It works by tapping directly into the part of the brain that regulates emotions, memory, as well as the neurohormone network of the brain. This therefore means that it promotes both mental and physical healing by regulating the brain's control of the body. BSP may be done with one or both eyes. It is performed by a trained BSP therapist who, with a pointer in front of the patient's eyes, slowly guides the gaze of the person in the therapy across the length of the visual field to identify the brain spot or trauma. When the pointer comes across a brain spot or trauma, the deep brain will reflect, sending signals to the therapist that a trauma has been detected. When a person gets traumatized, they get traumatized not in the neocortex, because the neocortex has language, thought, and content. It's underneath that neocortex, in the subcortex, where the trauma is experienced. In order for psychotherapists to be successful in working with trauma, they have to be able to access the parts of the brain that don't have language, don't have thought, but come primarily from intuition, from emotions and body experiences. This body and brain-based therapy is able to bypass the neocortex, the thinking language human brain, to get to the subcortex to release the trauma. BSP has been founded to be an effective therapy to help people that have experienced traumatic events recover. It is a model of therapy which is well known for its past results and positive outcomes. Therapists have been increasingly incorporating BSP to treat psychological and mental concerns. Therapists also use BSP to treat certain symptoms such as low motivation, poor concentration, stress, and certain emotional disturbances. BSP is suitable treatment for all forms of trauma, including PTSD, anxiety, anger issues, substance use disorder, chronic fatigue or chronic pain syndrome, impulse control disorders, all types of phobias and sport performance anxiety issues. Brainspotting psychology was created by Dr. David Graham in 2003, which is a body and brain-based therapy. As a result of his work, people who have had experienced traumatic events such as Hurricane Katrina, the attacks on the World Trade Center, as well as war veterans, have benefited from BSP. Many mental health professions have found BSP to be an effective form of treatment for several mental health problems and physical illnesses. I'm going to leave you with testimonials of people that we've already dealt with. You can contact us via our website, or you can leave comments below. Thank you so much for listening.